Hello everyone. I'm Laizari who's a Karkinos Cancer Care in Faldani. Today we speak about a word that quietly frightens every family, cancer. For years in our state, hearing that word meant something else too. Packing a bag and traveling far, maybe Guwahati, Kolkata, Vellore, Mumbai, Delhi, often for months and often at a cost that burdened families. Akoina cancer haiba wahai je tabu matamda yamna akitu jungba phawba family gi singi damakti yamna nungai taba aduna imungda cancer nare haiba se yawbo taragadi Manipur gi mapanda kari lamda chatkadori bano Vellore da chatkadra Kolkata chatkadra Guwahati Mumbai Delhi da chatkadra karamba doctor da tanagani karamaina layengani aduga magi sales yam tingna mapana chalaga layengani haiba gi adukumba yamna mi paiba adukuma wahi ni cancer haibasi adubu masi adum ahongba matam gi matungina ahongba lakle this is beginning to change aduna ngasi mag Imphal gi mayol da leiriba Karkinos Cancer Hospital da koi expert doctors mayam ma leire cancer lying lying pathap chatha duna cancer nariba miabu moibu cancer patients in the care piduna moibu lying pathap chatha duna moi punsi yam nungai na treatment piduna minor treatment lying pathap chatha duna leiri aduna today we have doctors specialist doctors caring for cancer patients right here in Imphal at Karkinos Cancer Hospital. Let me take the opportunity to introduce them. First, we have Dr. Thangjam Nirpendra, a consultant radiation oncologist with over a decade of experience in oncology care, radiation therapy, and cancer management. Holding an MD in radiotherapy, he has served in key clinical and public health roles, contributing significantly to the delivery of cancer care in Manipur. Welcome, Doctor.
Thank you.
We also have with us Dr. Pallavi Mehta, a senior consultant in clinical hematology with expertise in bone marrow transplantation, CAR T-cell therapy, and advanced cellular therapies. A DM in clinical hematology from Christian Medical College, CMC Vellore, and having practiced at Rajiv Gandhi Cancer Institute, Fortis Memorial Research Institute, Narayana Multi-Specialty Hospital, and Max Hospital. Dr. Pallavi specializes in the management of blood cancers as well as complex non-malignant blood disorders. Welcome, Doctor. Mathangda, we have Dr. Thingujam James, a consultant gynecology oncologist with specialist expertise in the surgical management of women's cancers, including ovarian, cervical, and uterine malignancies. He holds a fellowship in gynecological oncology through the Association of Gynecological Oncologists of India. Dr. Bursutaram Nokchari. And last but not least, we have with us Dr. Konzam Jeena Devi, a consultant anesthesiologist and critical care physician with over a decade of experience in intensive care medicine, anesthesia, and perioperative care. Holding an MD in anesthesiology and advanced training in critical care PDCC, she has been instrumental in managing complex and critically ill patients across tertiary healthcare settings. Dr. Vasutaram Nokchari. So we have all the experts, doctors from Karkinos Cancer Care Hospital with us today. We'll be discussing about what is cancer, and we'll be busting some myths about cancer, as well as we'll be talking about treatment facility available for cancer patients in Manipur, here in Manipur itself. To begin with, let me come to Dr. Thangjam Nirpendra. Doctor, akoina cancer haibasi taw matamda yamna kiba aduga magi lying pathapse kamain chathagani Manipur gi mapana chatpa taragani sel tingba karma doctor da approach tawgani haibe gi sukumba yamna worry myam lay. So but cancer is the same disease everywhere, whether it's in Manipur or in other parts of the country or the world. Aduna, why Manipur needs its own answer to cancer?
Thagachari. Question si akogi cancer gi harap matamdadi cancer gi scenario si Manipur ga athopa India ga thik passing si gi yengba matamda kadang khena bakra lek akogi Manipur si picture aga su cancer gi incidence prevalence ꯁꯤꯗꯗꯤ ꯌꯥꯝꯅ ꯋꯥꯡꯅ ꯂꯩꯕ ꯃꯐꯝ ꯑꯃ ꯑꯣꯏ ꯏꯟꯗꯤꯌꯥꯒꯤ not only India ꯑꯩꯈꯣꯏ ꯏꯟꯗꯤꯌꯥ ꯈꯛꯇꯪ ꯅꯠꯇꯕꯤꯗ ꯄ꯭ꯔꯤꯊꯤꯕꯤꯒꯤ ꯑꯣꯏꯅ ꯌꯦꯡꯕ ꯃꯇꯝꯗ globally if you look into it north east ꯁꯤ ꯑꯩꯈꯣꯏꯅ cancer hub ꯍꯥꯏꯅ ꯈꯪꯅꯔꯤꯕꯅꯤ
India ꯒꯤ ꯑꯣꯏꯅ
all over the world ꯌꯦꯡꯕ ꯃꯇꯝꯗꯁꯨ ꯀꯣ ꯑꯗꯒꯤ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯑꯣꯏꯅꯁꯨ ꯑꯗ ꯄ꯭ꯔꯤꯊꯤꯕꯤꯒꯤ cancer scenario ꯁꯤ ꯌꯦꯡꯕ ꯃꯇꯝꯗ north east ꯁꯤꯗꯩꯁꯤꯗ cancer ꯃꯈꯜ ꯈꯔ ꯂꯩ which is like ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯌꯥꯝꯅ ꯐꯪꯕ ꯃꯐꯝ ꯈꯔ ꯑꯩꯈꯣꯏ north east ꯗꯁꯨ ꯂꯩꯔꯤꯑꯕ ꯑꯗꯨꯃꯥꯏꯅ ꯇꯧꯗꯅ ꯃꯅꯤꯄꯨꯔꯁꯤꯁꯨ north east ꯀꯤ ꯄꯥꯔꯠ ꯑꯃ ꯑꯣꯏꯖꯔꯒꯁꯨ ꯀꯦꯟꯁꯔꯒꯤ ꯏꯟꯁꯤꯗꯦꯟꯁꯇꯩꯁꯤꯗ ꯃꯁꯤꯡ ꯃꯈꯜꯁꯦ ꯌꯥꯝꯅ ꯋꯥꯡꯅ ꯂꯩꯌꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯌꯦꯡꯕ ꯃꯇꯝꯗ ꯁꯥꯎꯠ ꯏꯟꯗꯤꯌꯥ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯥꯎꯗꯔꯟ ꯁꯥꯏꯠꯁꯤꯗꯩꯁꯤꯗ ꯀꯦꯟꯁꯔ ꯃꯈꯜ ꯈꯔ ꯂꯩ ꯑꯗꯨꯗꯅ ꯌꯥꯝꯅ ꯔꯦꯌꯔ ꯑꯣꯏꯅ ꯂꯩꯔꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯅꯣꯔꯠ ꯏꯁꯇꯔꯟ ꯏꯟꯗꯤꯌꯥꯁꯤꯗꯩꯁꯤꯗ ꯁ꯭ꯄꯦꯁꯤꯌꯦꯜꯂꯤ ꯃꯅꯤꯄꯨꯔ ꯅꯥꯒꯥꯂꯦꯟ ꯁ꯭ꯋꯥꯏꯁꯤꯗꯩꯁꯤꯗ ꯌꯥꯝꯅ ꯍꯦꯟꯅ ꯀꯃꯟ ꯑꯣꯏꯕ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯅꯥꯇꯣꯟꯒꯤ ꯃꯅꯤꯡ ꯊꯪꯕ ꯖꯒꯥꯗ ꯂꯩꯔꯤꯕ ꯅꯦꯖꯣꯐꯦꯔꯤꯡꯁꯀ ꯍꯥꯏꯔꯤꯕ ꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯌꯥꯝꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯅꯤꯄꯨꯔ ꯁꯤꯗꯩꯁꯤꯗ ꯌꯥꯝꯅ ꯃꯥꯒꯤ ꯀꯩꯅꯣꯁꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯆꯥꯡꯁꯤ ꯌꯥꯝ ꯋꯥꯡꯉꯦ ꯑꯗꯨꯗꯒꯤ ꯑꯩꯈꯣꯏꯅ ꯑꯃꯨꯛ ꯑꯩꯈꯣꯏꯒꯤ ꯆꯥꯔꯤꯕ ꯆꯤꯟꯖꯥꯛ ꯑꯗꯒꯤ ꯍꯧꯖꯤꯛꯀꯤ ꯅꯍꯥꯁꯤꯡꯁꯤꯅ ꯇꯣꯕꯦꯀꯣ ꯁꯤꯖꯤꯟꯅꯕ ꯍꯤꯗꯥꯛ ꯃꯅꯥ ꯁꯤꯖꯤꯟꯅꯕ ꯆꯨꯔꯨꯞ ꯁꯤꯖꯤꯟꯅꯔꯛꯄ ꯈꯩꯅꯤ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯉꯁꯥꯏ ꯇꯂꯞꯀ ꯁꯤꯖꯤꯟꯅꯔꯤꯕ ꯃꯌꯥꯝꯁꯤꯡꯁꯤꯅ ꯁꯤꯒ ꯃꯔꯤ ꯂꯩꯅꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯤꯒ ꯊꯣꯛꯄ ꯌꯥꯕ ꯀꯦꯟꯁꯔ ꯃꯈꯜ ꯈꯔ ꯍꯥꯏꯔꯒꯗꯤ ꯑꯣꯔꯦꯜ ꯀꯦꯟꯁꯔ ꯀꯣ ꯂꯩꯒꯤ ꯀꯦꯟꯁꯔ ꯈꯅꯥꯎꯒꯤ ꯃꯅꯨꯡꯒꯤ ꯀꯦꯟꯁꯔ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯐꯨꯗ ꯄꯥꯏꯞꯀꯤ ꯀꯦꯟꯁꯔ ꯒ꯭ꯌꯥꯁꯇ꯭ꯔꯣꯏꯟꯇꯦꯁꯇꯤꯅꯦꯜ ꯇ꯭ꯔꯦꯛ ꯆꯈꯥꯎꯒꯤ ꯀꯣꯂꯣꯟ ꯁꯤꯒꯨꯝꯕ ꯃꯌꯥꯝꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯅꯤꯄꯨꯔꯁꯤꯗ ꯌꯥꯝꯅ ꯆꯥꯡ ꯌꯥꯝ ꯋꯥꯡꯉꯦ ꯑꯗꯒꯤ ꯅꯨꯄꯤꯔꯣꯝꯗ ꯍꯥꯏꯔꯒꯁꯨ ꯑꯩꯈꯣꯏ ꯑꯉꯥꯡꯈꯥꯎ ꯃꯆꯤꯟꯒꯤ ꯀꯦꯟꯁꯔ ꯁꯔꯚꯥꯏꯀꯦꯜ ꯀꯦꯟꯁꯔ ꯕ꯭ꯔꯦꯁ ꯀꯦꯟꯁꯔ ꯃꯣꯏꯁꯤ ꯆꯥꯡ ꯌꯥꯝ ꯋꯥꯡꯉꯦ ꯀꯩꯅꯣ ꯇꯧꯕꯁꯤꯗꯩꯁꯤꯗ ꯑꯇꯩꯒ ꯌꯦꯡꯅꯕ ꯃꯇꯝꯗꯁꯨꯀꯣ ꯑꯗꯨꯒ ꯍꯧꯖꯤꯛ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯦꯃꯣꯒ꯭ꯔꯥꯐꯤꯛ ꯄ꯭ꯔꯣꯐꯥꯏꯜꯗ ꯅꯠꯇ꯭ꯔꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯦꯁꯦꯟꯁꯤꯡꯁꯤꯒꯤ ꯁꯣꯁꯤꯑꯣ ꯏꯀꯣꯅꯣꯃꯤꯛ ꯀꯟꯗꯤꯁꯟꯗ ꯌꯦꯡꯂꯨꯔꯒꯗꯤ ꯃꯅꯤꯄꯨꯔꯁꯤ ꯌꯥꯝꯅ ꯁꯣꯠꯊꯅ ꯂꯩꯔꯤꯕ ꯄꯩꯁꯥ ꯅꯨꯡꯁꯥꯒꯤ ꯂꯝꯗꯁꯨ ꯌꯥꯝ ꯁꯣꯠꯊꯅ ꯂꯩꯔꯤꯕ ꯃꯐꯝ ꯑꯃ ꯑꯣꯏꯕꯅꯤ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏꯅ ꯑꯅꯥꯕꯁꯤꯅ ꯀꯦꯟꯁꯔ ꯑꯃ ꯅꯥꯔꯦ ꯍꯥꯏꯅ ꯗꯥꯏꯒꯅꯣꯁ ꯇꯧꯔꯛꯄ ꯃꯇꯝꯗ ꯃꯣꯏꯒꯤ ꯋꯥꯈꯜꯁꯤꯗ ꯂꯩꯗꯣꯏꯁꯤ ꯊꯥꯏꯅꯗꯒꯤ ꯍꯥꯟꯅ ꯃꯤꯊ ꯑꯃ ꯊꯥꯖꯕ ꯋꯥꯈꯜꯗ ꯑꯃ ꯂꯩꯖꯩ ꯀꯦꯟꯁꯔꯕꯨ ꯅꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯁꯤ ꯂꯥꯌꯦꯡꯕ ꯉꯝꯃꯔꯣꯏ ꯄꯩꯁꯥ ꯌꯥꯝ ꯆꯪꯕ ꯂꯥꯏꯅꯥ ꯑꯃꯅꯤ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏ ꯁꯤꯒꯤ ꯂꯥꯌꯦꯡꯅꯕ ꯍꯣꯠꯅꯕꯗ ꯌꯨꯝ ꯏꯪꯈꯣꯜ ꯅꯣꯏ ꯇꯨꯝꯅ ꯅꯣꯏ ꯃꯥꯡꯒꯗꯧꯔꯤꯕꯅꯤ ꯍꯥꯏꯅ ꯋꯥꯈꯜ ꯁꯤꯒꯨꯝꯕ ꯃꯌꯥꯝ ꯑꯃꯁꯨ ꯂꯩꯅꯩ ꯁꯤ ꯂꯩꯇꯕ ꯅꯠꯇꯦ ꯃꯇꯝ ꯈꯔꯒꯤ ꯃꯃꯥꯡꯗꯗꯤ ꯆꯍꯤ ꯈꯔꯒꯤ ꯃꯃꯥꯡꯗꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯦꯟꯁꯔꯁꯤ ꯅꯥꯔꯦ ꯍꯥꯏꯕ ꯃꯇꯝꯗ ꯃꯄꯥꯟꯗ ꯆꯠꯂꯒ ꯗꯦꯜꯂꯤꯗ ꯑꯗꯒꯤ ꯃꯨꯝꯕꯥꯏꯗ ꯇꯥꯇꯥꯗꯒ ꯆꯠꯇꯅꯀꯣ ꯃꯌꯥꯝ ꯑꯃ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯦꯜ ꯇꯤꯡꯅ ꯆꯠꯅꯔꯝꯃꯦꯕ ꯑꯗꯨꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯑꯩꯈꯣꯏ ꯅꯥꯔꯦ ꯍꯥꯏꯕ ꯃꯇꯝꯗ ꯃꯄꯥꯟꯗ ꯆꯠꯄꯅꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯂꯩꯖꯔꯝꯕ ꯄꯩꯁꯥ ꯂꯣꯏ ꯇꯨꯝꯕ ꯑꯗꯒꯤ ꯂꯥꯌꯦꯡꯗꯨꯗ ꯅꯠꯇꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯆꯠꯄꯗ ꯃꯇꯣꯝꯗ ꯆꯠꯄ ꯌꯥꯗꯕꯅꯤna ꯃꯥꯒꯤ ꯐꯦꯃꯤꯂꯤ ꯃꯦꯝꯕꯔꯁ ꯈꯔ ꯍꯧꯔꯒ ꯆꯠꯀꯅꯤ ꯃꯔꯤ ꯃꯇꯥ ꯈꯔ ꯌꯥꯎꯔꯒ ꯆꯠꯀꯅꯤ ꯑꯥꯗ ꯂꯩꯔꯨꯕ ꯃꯇꯝꯗ ꯆꯥꯅꯕ ꯊꯛꯅꯕ ꯃꯌꯥꯝꯁꯤꯅ ꯃꯌꯥꯝ ꯇꯧꯕ ꯃꯇꯝꯗꯨꯗ ꯑꯗꯒꯤ ꯂꯦꯡꯒ꯭ꯋꯦꯖꯀꯤ ꯕꯦꯔꯤꯌꯔ ꯑꯃ ꯂꯩꯕ ꯋꯥ ꯉꯥꯡꯕꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯤ ꯈꯔ ꯈꯛꯇꯅꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯄꯥꯟꯒꯤ ꯑꯩꯈꯣꯏ ꯍꯤꯟꯗꯤ ꯈꯪꯗꯦ ꯏꯪꯂꯤꯁ ꯈꯪꯗꯦ ꯌꯥꯝꯅ ꯐ꯭ꯂꯨꯋꯦꯟꯠꯂꯤ ꯉꯥꯡꯕ ꯑꯟꯗꯔꯁꯇꯦꯟ ꯇꯧꯕ ꯉꯝꯃꯤꯁꯦ ꯑꯗꯨ ꯑꯌꯥꯝꯕ ꯃꯤ ꯈꯔ ꯑꯃꯗꯤ ꯁꯤ ꯄꯥꯎꯁꯦ ꯏꯟꯊꯤ ꯅꯨꯡꯉꯥꯏꯅ ꯐꯥꯎꯅꯕ ꯉꯝꯗꯕ ꯑꯗꯨꯅ ꯑꯗꯨꯒꯨꯝꯕ ꯕꯦꯔꯤꯌꯔ ꯃꯌꯥꯝꯗꯣ ꯂꯩꯕꯅꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯁꯤꯅꯥꯔꯤꯑꯣꯁꯤꯒ ꯃꯄꯥꯟꯗ ꯊꯣꯛꯂꯛꯑꯒ ꯂꯩꯕ ꯃꯇꯝꯗ ꯃꯄꯥꯟꯒꯤꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯦꯇ꯭ꯔꯣꯄꯣꯂꯤꯇꯟ ꯁꯤꯇꯤꯁ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯗꯤꯜꯂꯤ ꯃꯨꯝꯕꯥꯏ ꯃꯣꯏꯁꯤꯡꯁꯤꯗ ꯌꯦꯡꯕ ꯃꯇꯝꯗꯗꯤ ꯃꯣꯏꯁꯤ ꯗꯦ ꯑꯥꯔ ꯃꯣꯔ ꯑꯦꯐ꯭ꯂꯨꯌꯦꯟꯠ ꯄꯩꯁꯥ ꯅꯨꯡꯁꯥ ꯍꯦꯟꯅ ꯃꯣꯏꯅ ꯂꯩ ꯑꯗꯒꯤ ꯂꯣꯟꯂꯤ ꯍꯥꯏꯔꯦ ꯃꯣꯏꯅ ꯍꯦꯟꯅ ꯈꯪꯅꯕ ꯍꯦꯜꯂꯤꯀꯣ ꯑꯗꯨꯅ ꯃꯣꯏꯒꯤ ꯑꯁꯣꯝ ꯅꯥꯀꯟꯗ ꯇꯧꯔꯛꯄ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯑꯩꯈꯣꯏ ꯁꯤꯗ ꯗꯥꯏꯔꯦꯛ ꯏꯟꯇꯦꯇꯣ ꯄꯣꯔꯛꯄꯁꯨ ꯌꯥꯗꯦꯕ ꯑꯗꯨꯅ ꯀꯦꯟꯁꯔꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤꯁꯨ ꯑꯩꯈꯣꯏ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯁꯤꯅꯥꯔꯤꯑꯣꯗꯗꯤ ꯃꯅꯤꯄꯨꯔ ꯈꯛꯇꯪꯒꯤ ꯋꯥ ꯅꯠꯇꯦ ꯀꯦꯟꯁꯔ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯒꯦ ꯍꯥꯏꯇꯥꯔꯒꯗꯤ ꯏꯠꯁ ꯒꯣꯏꯡ ꯇꯨ ꯕꯤ ꯃꯣꯔ ꯑꯣꯐ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯂꯥꯏꯖ ꯃꯤꯗꯨꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯑꯩꯈꯣꯏꯅ ꯂꯣꯏꯅꯃꯛ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯂꯥꯏꯖ ꯇꯧꯔꯛꯄ ꯗꯔꯀꯥꯔ
ꯃꯥꯒꯤ
ꯂꯩꯔꯦ
ꯐꯦꯃꯤꯂꯤ ꯀꯟꯗꯤꯁꯟꯁꯨ
ꯌꯦꯁ
ꯌꯦꯡꯉꯛꯑꯒ
ꯌꯦꯁ 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 ꯑꯗꯨꯅ ꯈꯨꯗꯝ ꯑꯣꯏꯅ ꯍꯥꯏꯔꯕꯗ ꯍꯧꯖꯤꯛꯇꯤ ꯑꯅꯧꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯃꯌꯥꯝ ꯑꯃ ꯂꯥꯛꯏꯀꯣ ꯀꯦꯟꯁꯔꯒꯤꯁꯤ ꯏꯝꯃ꯭ꯌꯨꯅꯣꯊꯦꯔꯥꯄꯤ ꯀꯥꯏꯅꯒ ꯂꯥꯛꯏꯕ ꯁꯤꯒꯨꯝꯕꯁꯤꯡꯁꯤꯗꯤ ꯍꯧꯖꯤꯛꯀꯤ ꯑꯣꯏꯅꯗꯤ ꯌꯥꯝꯅ ꯇꯥꯡꯉꯤ ꯑꯦꯛꯁꯄꯦꯟꯁꯤꯞ ꯑꯣꯏ ꯑꯗꯨꯅ ꯈꯔ ꯄꯩꯁꯥ ꯅꯨꯡꯁꯥ ꯐꯖꯅ ꯂꯩꯖꯗꯕ ꯃꯤꯁꯤꯡꯁꯤꯅ ꯃꯣꯏꯁꯦ ꯑꯦꯐꯣꯔꯠ ꯇꯧꯕ ꯉꯝꯗꯕꯁꯨ ꯑꯗꯨꯝ ꯌꯥꯎꯋꯦꯕ ꯑꯗꯨꯅ ꯁꯤꯁꯤꯡꯁꯤ ꯌꯦꯡꯂꯨꯔꯒ ꯑꯩꯈꯣꯏꯅ ꯃꯣꯔ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯂꯥꯏꯖ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯑꯃ ꯗꯔꯀꯥꯔ ꯂꯩ
ꯑꯗꯨꯅ ꯃꯣꯔ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯂꯥꯏꯖ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯗꯔꯀꯥꯔ ꯇꯥꯕꯅꯤꯅ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯄꯦꯁꯦꯟꯒꯤꯁꯤꯡꯒꯤꯗꯃꯛꯇ ꯃꯣꯔ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯂꯥꯏꯖ ꯀꯁꯇꯃꯥꯏꯖ ꯑꯣꯏꯕ ꯑꯗꯨꯒꯨꯝꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯉꯥꯏ ꯐꯗꯦ ꯍꯥꯏꯅ ꯊꯝꯕꯤꯕꯅꯤ ꯑꯗꯒꯤ ꯗꯣꯛꯇꯔꯗꯒꯤ ꯈꯪꯖꯅꯤꯡꯕꯁꯦ ꯍꯧꯖꯤꯛꯇꯤ ꯍꯥꯟꯅ ꯍꯣꯏ ꯃꯄꯥꯟꯗ ꯌꯥꯝ ꯆꯠꯂꯝꯕ ꯍꯧꯖꯤꯛ ꯇ꯭ꯔꯦꯟꯁꯦ ꯍꯣꯡꯉꯛꯄꯒꯤ ꯇ꯭ꯔꯦꯟꯁꯦ ꯁꯨꯝ ꯑꯩꯈꯣꯏꯅꯁꯨ ꯎꯖꯔꯛꯄ ꯍꯥꯏꯕ ꯇꯥꯔꯦ ꯍꯥꯏꯕꯗꯤ ꯃꯅꯤꯄꯨꯔꯃꯛꯇꯗ ꯍꯧꯖꯤꯛ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯀꯦꯟꯁꯔ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯁꯨꯃꯥꯏꯅ ꯂꯩꯔꯦ ꯕꯤగ్ ꯐꯦꯁꯤꯂꯤꯇꯤ ꯕꯤꯜꯗꯤꯡ ꯄꯣꯔꯣꯝꯄꯥꯠꯇ ꯀꯦꯝꯄꯁ ꯁꯨꯃꯥꯏꯅ ꯂꯩꯔꯦ ꯑꯗꯨꯒ ꯑꯦꯛꯁꯄꯔꯠ ꯗꯣꯛꯇꯔꯁꯨ ꯃꯌꯥꯝ ꯂꯩꯔꯕꯅꯤना ꯃꯥꯏꯟ ꯁꯦꯠꯁꯦ ꯍꯥꯟꯅ ꯃꯄꯥꯟꯗ ꯆꯠꯇ꯭ꯔꯒꯗꯤ ꯑꯩꯈꯣꯏ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯂꯥꯌꯦꯡꯕꯁꯦ ꯌꯥꯔꯣꯏ ꯍꯥꯏꯕꯒꯤ ꯃꯥꯏꯟꯁꯦꯠꯁꯤꯗ ꯑꯍꯣꯡꯕ ꯆꯦꯟꯖ ꯑꯃ ꯂꯥꯛꯄ ꯊꯦꯡꯅꯕꯤꯕ꯭ꯔꯥ ꯗꯣꯛꯇꯔ
ꯆꯨꯝꯃꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯥꯟꯅ ꯆꯍꯤ ꯈꯔꯒꯤ ꯃꯃꯥꯡꯗꯗꯤ ꯑꯩꯈꯣꯏ ꯃꯅꯤꯄꯨꯔ ꯁꯤꯗꯩꯁꯤꯗ ꯄꯥꯔꯇꯤꯀꯨꯂꯔ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯑꯣꯏꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯂꯥꯌꯦꯡꯐꯝꯁꯤ ꯃꯄꯨꯡ ꯐꯥꯕ ꯍꯥꯏꯇꯥꯔꯦ ꯁꯤ ꯀꯌꯥ ꯂꯩꯔꯝꯗꯦ ꯍꯥꯟꯅ ꯂꯩꯔꯝꯃꯤꯁꯤꯗꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯃꯌꯥꯏꯕꯒꯤ ꯗꯣꯛꯇꯔ ꯑꯃ ꯇꯣꯉꯥꯟꯅ ꯂꯩꯔꯅꯤ ꯁꯔꯖꯔꯤꯒꯤ ꯇꯣꯉꯥꯟꯕ ꯑꯃ ꯂꯩꯕ ꯑꯗꯩ ꯀꯤꯃꯣ ꯄꯤꯕ ꯇꯣꯉꯥꯟꯅ ꯑꯗꯩ ꯃꯐꯝ ꯇꯣꯉꯥꯟ ꯇꯣꯉꯥꯟꯅ ꯂꯣꯏ ꯆꯥꯏꯊꯣꯛꯑꯒ ꯂꯩꯕꯅꯤꯅ ꯄꯦꯁꯦꯟ ꯑꯃꯅ ꯃꯥꯒꯤ ꯑꯅꯥꯕꯁꯤ ꯗꯥꯏꯒꯅꯣꯁ ꯇꯧꯔꯕ ꯃꯇꯨꯡꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯒꯦ ꯍꯥꯏ ꯇꯥꯔꯒꯗꯤ ꯇꯣꯉꯥꯟ ꯇꯣꯉꯥꯟꯕ ꯃꯐꯝꯁꯤꯗ ꯆꯠꯄꯗ ꯃꯣꯏꯒꯤ ꯑꯋꯥꯕ ꯀꯌꯥ ꯑꯃ ꯊꯦꯡꯅꯩꯌꯦꯕ ꯑꯗꯒꯤ ꯑꯇꯣꯞꯄ ꯑꯃꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯂꯥꯏꯅꯥꯁꯤ ꯗꯥꯏꯒꯅꯣꯁ ꯇꯧꯕ ꯃꯇꯝꯗ ꯗꯣꯛꯇꯔ ꯑꯃꯒꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯣꯑꯣꯔꯗꯤꯅꯦꯁꯟ ꯑꯗꯒꯤ ꯗꯤꯁꯀꯁꯟ ꯇꯧꯅꯕꯒꯤ ꯃꯇꯥꯡꯁꯤꯗꯁꯨ ꯈꯔ ꯋꯥꯠꯄ꯭ꯔꯥ ꯍꯥꯏꯅ ꯈꯜꯂꯤ ꯍꯥꯟꯅ ꯃꯃꯥꯡꯗꯗꯤ ꯆꯍꯤ ꯈꯔꯒꯤ ꯃꯃꯥꯡꯗꯗꯤꯀꯣ ꯁꯦꯝ ꯔꯨꯞ ꯑꯃꯗ ꯂꯩꯇꯕꯅ ꯑꯗꯨꯅ ꯑꯗꯨꯒꯤ ꯃꯌꯥꯝꯁꯤꯡꯗꯨꯒ ꯃꯔꯤ ꯂꯩꯅꯅ ꯄꯦꯁꯦꯟꯁꯤꯡꯁꯤꯅ ꯍꯦꯛ ꯃꯄꯥꯟꯗ ꯆꯠꯂꯒ ꯂꯥꯌꯦꯡꯕꯁꯤ ꯃꯣꯏꯁꯤ ꯑꯩ ꯉꯁꯥꯏ ꯃꯃꯥꯡꯗꯁꯨ ꯄꯟꯖꯈꯤꯕ ꯗꯥꯏꯒꯅꯣꯁꯄꯨ ꯇꯧꯔꯒꯗꯤ ꯀꯦꯟꯁꯔꯅꯦꯕꯨ ꯍꯥꯏꯔꯒꯗꯤ ꯃꯄꯥꯟꯗ ꯆꯠꯂ ꯂꯥꯌꯦꯡꯒꯗꯕꯅꯤ ꯍꯥꯏꯕꯒꯤ ꯊꯥꯖꯕ ꯃꯤꯠ ꯑꯃ ꯑꯗꯨꯝ ꯂꯩꯔꯝꯃꯦꯕ ꯑꯗꯨꯕꯨ ꯍꯧꯖꯤꯛꯇꯤ ꯃꯗꯨ ꯑꯍꯣꯡꯕ ꯐꯅ ꯌꯥꯝꯅ ꯂꯥꯛꯑꯦ ꯍꯥꯏꯅ ꯈꯜꯂꯤ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯏꯠꯁꯦꯜꯐ ꯑꯩꯈꯣꯏ ꯀꯥꯔꯀꯤꯅꯣꯁꯤꯁꯨ ꯃꯥꯒꯤ ꯁꯦꯝ ꯔꯨꯐꯇꯨꯗ ꯑꯩꯈꯣꯏ ꯁꯔꯖꯤꯀꯦꯜ ꯑꯣꯟꯀꯣꯂꯣꯖꯤ ꯁꯔꯖꯔꯤꯒꯤ ꯑꯣꯏꯕ ꯔꯦꯗꯤꯌꯦꯁꯟꯒꯤ ꯑꯣꯏꯕ ꯃꯣꯔ ꯑꯦꯗꯚꯥꯟꯁ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯑꯦꯗꯚꯥꯟꯁ ꯑꯐꯕ ꯃꯈꯜꯒꯤ ꯈꯨꯠꯁꯨ ꯈꯨꯠꯂꯥꯏ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩꯔꯒ ꯃꯩ ꯌꯥꯏꯕꯒꯤꯀꯣ ꯑꯗꯨꯗꯒꯤ ꯑꯃꯨꯛ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯍꯤꯃꯥꯇꯣꯂꯣꯖꯤꯒꯤ ꯑꯣꯏꯕ ꯂꯤꯀ꯭ꯌꯨꯃꯤꯌꯥꯒꯤꯀꯣ ꯕ꯭ꯂꯗꯀꯤ ꯑꯣꯏꯕ ꯀꯦꯟꯁꯔ ꯁꯤꯗꯁꯨ ꯂꯣꯏꯅꯃꯛ ꯄꯨꯂꯞ ꯑꯣꯏꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯕ ꯌꯥꯔꯕ ꯑꯗꯨꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯥꯏꯒꯅꯣꯁꯇꯤꯛ ꯐꯦꯁꯤꯂꯤꯇꯤꯁ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯔꯦꯗꯤꯑꯣꯂꯣꯖꯤꯒꯤ ꯑꯣꯏꯕ ꯁꯤ ꯇꯤ ꯑꯦꯝ ꯑꯥꯔ ꯑꯥꯏ ꯄꯦꯠ ꯁ꯭ꯀꯦꯟ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯦꯊꯣꯂꯣꯖꯤꯒꯤ ꯄꯥꯔꯠ ꯅꯣꯏꯅ ꯃꯐꯝ ꯑꯃꯗ ꯄꯨꯂꯞ ꯂꯩꯔꯕꯅꯤꯅ ꯄꯦꯁꯦꯟꯅ ꯂꯥꯛꯑꯒ ꯂꯥꯌꯦꯡꯕꯗ ꯃꯐꯝ ꯀꯣꯏꯆꯠ ꯆꯠꯄꯒꯤ ꯑꯋꯥꯕꯗꯨ ꯂꯩꯔꯔꯣꯏ
The single roof ꯂꯣꯏꯅꯃꯛꯁꯦ
ꯁꯤꯡꯒꯜ
ꯂꯩꯔꯦꯕ
ꯔꯨꯞꯇ ꯄꯨꯂꯞꯇꯨ ꯅꯣꯏ ꯂꯩꯔꯕꯅꯤ ꯑꯗꯨꯅ ꯄꯦꯁꯦꯟꯅ ꯃꯥꯅ ꯆꯠꯄꯒꯤ ꯑꯋꯥꯕꯁꯨ ꯂꯩꯔꯔꯣꯏ ꯄ꯭ꯂꯁ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯣꯛꯇꯔ ꯃꯁꯦꯟꯗꯁꯨ ꯄꯦꯁꯦꯟꯗꯨꯒꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯀꯔꯤ ꯇꯧꯒꯗꯒꯦ ꯀꯔꯤ ꯂꯧꯈꯠꯀꯗꯒꯦ ꯍꯥꯏꯕꯁꯦ ꯑꯩꯈꯣꯏ ꯃꯁꯦꯟ ꯗꯤꯁꯀꯁ ꯇꯧꯅꯔꯒ ꯀꯟꯐ꯭ꯌꯨꯖꯟ ꯑꯝꯇ ꯂꯩꯇ꯭ꯔꯦꯕ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏ ꯁꯤꯒꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯑꯃꯅ ꯌꯥꯝꯅꯁꯨ ꯃꯔꯨ ꯑꯣꯏꯕꯀꯣ ꯀꯦꯟꯁꯔꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯕ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯕꯣꯔꯗ ꯐꯝꯕ ꯍꯥꯏꯁꯦ ꯃꯄꯥꯟꯒꯤ ꯍꯣꯁꯄꯤꯇꯥꯜꯁꯤꯡꯗ ꯑꯩꯈꯣꯏ ꯑꯗꯨꯝ ꯇꯥꯔꯝꯒꯅꯤ ꯇꯥꯇꯥꯗ ꯆꯠꯄ ꯃꯇꯝꯗ ꯃꯣꯏꯗꯤ ꯕꯣꯔꯗ ꯐꯝꯃꯤ ꯍꯥꯏ ꯕꯣꯔꯗ ꯐꯝꯕ ꯂꯣꯏꯔꯀꯥꯟꯗ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯗꯣ ꯍꯧꯋꯦꯅ ꯁꯤꯒꯤ ꯄꯣꯠꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯥꯔꯀꯤꯅꯣꯁꯇ ꯃꯁꯤ ꯌꯥꯝꯅ ꯃꯔꯨ ꯑꯣꯏꯕ ꯑꯩꯈꯣꯏ ꯁ꯭ꯇꯦꯞ ꯑꯃ ꯑꯣꯏꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯒꯤ ꯁ꯭ꯇꯦꯞ ꯑꯃ ꯑꯣꯏꯅ ꯁꯤ ꯂꯧꯏ ꯑꯦꯕ꯭ꯔꯤ ꯄꯦꯁꯦꯟ ꯈꯨꯗꯤꯡꯃꯛ ꯂꯥꯛꯄ ꯈꯨꯗꯤꯡꯃꯛ ꯑꯩꯈꯣꯏ ꯕꯣꯔꯗ ꯂꯣꯏꯅ ꯐꯝꯃꯤ ꯕꯣꯔꯗꯁꯤꯗꯩꯁꯤꯗ ꯇꯧꯔꯤꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯁ꯭ꯄꯤꯁꯦꯂꯤꯁ ꯃꯌꯥꯝ ꯑꯃ ꯃꯥꯒꯤ ꯐꯤꯜꯗꯨꯗ ꯍꯦꯟꯅ ꯈꯪ ꯍꯩꯔꯕ ꯃꯌꯥꯝ ꯑꯃ ꯁꯤꯗ ꯂꯩꯔꯤꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯃꯅꯨꯡꯒꯤ ꯗꯣꯛꯇꯔ ꯃꯌꯥꯝ ꯑꯃ ꯌꯥꯎꯔꯅꯤ ꯗꯣꯛꯇꯔ ꯁꯤꯒꯤ ꯑꯩꯈꯣꯏ ꯍꯣꯁꯄꯤꯇꯥꯜꯁꯤꯒꯤ ꯅꯠꯇꯕ ꯃꯄꯥꯟꯒꯤ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯑꯇꯣꯞꯄ ꯀꯥꯎꯟꯇꯔ ꯄꯥꯔꯠ ꯀꯥꯔꯀꯤꯅꯣꯁꯀꯤ ꯑꯣꯏꯕ ꯁ꯭ꯄꯦꯁꯤꯂꯤꯁ ꯃꯌꯥꯝ ꯑꯃꯁꯨ ꯌꯥꯎꯒꯗꯧꯔꯤꯅꯤ ꯄ꯭ꯂꯁ ꯏꯟꯇꯔꯅꯦꯁꯅꯦꯜ ꯑꯣꯏꯕ ꯃꯣꯏꯁꯨ ꯑꯗꯨꯝ ꯌꯥꯎꯔꯤ ꯑꯗꯨꯅ ꯄꯨꯂꯞꯁꯤ ꯑꯩꯈꯣꯏ ꯐꯝꯃꯤꯟꯅꯔꯒ ꯃꯜꯇꯤ ꯗꯤꯁꯤꯄ꯭ꯂꯤꯅꯔꯤ ꯇ꯭ꯌꯨꯃꯔ ꯕꯣꯔꯗ ꯚꯔꯆꯨꯋꯦꯜ ꯇ꯭ꯌꯨꯃꯔ ꯕꯣꯔꯗ ꯍꯥꯏꯅ ꯍꯥꯏꯀꯣ ꯁꯤꯒꯤ ꯄꯣꯠꯁꯤ ꯄꯨꯂꯞ ꯐꯝꯃꯤꯟꯅꯔꯒ ꯀꯦꯁꯁꯤ ꯑꯩꯈꯣꯏꯅ ꯊꯥꯡꯗꯣꯛꯑꯀꯥꯟꯗ ꯃꯥꯒꯤ ꯑꯅꯥꯕꯁꯤꯅ ꯁꯤꯅꯤ ꯁꯤꯗ ꯁꯤꯒꯤ ꯏꯟꯚꯦꯁꯇꯤꯒꯦꯁꯟ ꯇꯧꯕ ꯃꯇꯝꯗ ꯁꯤ ꯐꯪꯉꯤ ꯃꯥꯒꯤ ꯂꯥꯏꯑꯣꯡꯅ ꯁꯤꯅꯤ ꯍꯥꯏꯕ ꯃꯌꯥꯝꯁꯤ ꯂꯣꯏꯅ ꯄꯨꯊꯣꯛꯑꯒ ꯄꯨꯂꯞ ꯅꯩꯅꯔꯕ ꯃꯇꯨꯡꯗ ꯑꯅꯥꯕꯁꯤ ꯃꯥꯒꯤ ꯆꯞ ꯆꯥꯕ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯁꯤ ꯑꯣꯏꯔꯅꯤ ꯁꯤꯗꯩ ꯍꯧꯔꯁꯤ ꯍꯥꯏꯕꯁꯤ ꯑꯩꯈꯣꯏ ꯕꯣꯔꯗꯁꯤꯗ ꯗꯤꯁꯥꯏꯠ ꯇꯧꯅꯩꯌꯦꯕ ꯑꯗꯨꯅ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯜ ꯑꯃꯈꯛꯀꯤ ꯗꯤꯁꯤꯖꯟ ꯉꯥꯛꯇ ꯑꯣꯏꯗꯦ ꯑꯗꯨꯅ ꯁꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯍꯧꯕꯒꯤ ꯑꯣꯏꯅ ꯁꯤ ꯗꯤꯁꯤꯖꯟ ꯃꯦꯀꯤꯡꯁꯦ ꯁꯤ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯁ꯭ꯇꯦꯞꯅꯦꯅ ꯑꯩꯈꯣꯏ ꯂꯧꯖꯩ
Thank you, Doctor. Aduna Karkinos, it's not only Manipur Katangnati, it's national level, international level, the experts mayam yauraga, adumaina chain ama cancer care gidamakta aduguma leiba hospital network ama oibanina. Aduna any patient Manipur gi cancer care Karkinos hospital lakma tamda mogi line pathapse kamain sathagadage habse expert mayam zigi board adumaina meeting phamaga best treatment options in locally have to do doctor and thambibani mathang ne have doctor thingujam james lakjage doctor akoina cancer ji my last stage to go ita di akoina best option pi bataraga su magi lying pathap sidi kitang di why have a challenges me am le du but akoina yam nganna screen da hobo taraga di khangdo hobo taraga di lying pathap sa thaba da yamna lie haibase doctor experts sing hanjan hanjan adum hairba wafam ni but today's the awareness is adum khara de dum wat pra cancer haiba taraga di changu hospital da changu gadawo kitang ki ba phawba duga cancer ri ai screen ga tawba chatpaje ai ji cancer narak torebra haibagi ki ba phawba swai ji kitang myth ama leibe je khara bust tawbiu aduga early screening gi importance se khara highlight tawbiu doctor
hoi yam chumwa hamne akoina cancer bu hair di mayam je ki ba haitare adagi kano tawba se loin tawne yam kayo di cancer bu narak di end stage ne na mayam lo khangne to khanei haitare ko aduda akoina tawba se usually screening hai akoina hai je cancer je detect tawge have na te akoina screening hai se sengna hai ragadi akoina screening tawba se mi khara na jum hainari moi masan as akoi de na ba yaude akoi de symptom kai gom ta leite ne screening tawba gi atha thokte khote na hai base jum hainai ado main purpose for screening the anabada screen anabada tawgadab natte nadriba mi to ado screening tawgadab ne haibagi atradi akoina screening je tahu targa di ngallingai da samna haida kan the example oina cervical cancer gi screening hai nangang khau muchin gi se si se akoina screening tahu targa di kamain to ga kan da magi changes ama haibagi atradi cancer di yaudriba pre cancerous state haitare cancer maksu yaudriba cancer da gi normal da gi kitang lanjal laba haitare sigi mafam jida akoina thengna huktar targadi icham chamba procedure am tawraga yam kuida ba haitare ko procedure macham tawraga sidagi sig laying pa thapse tawraga mangon dagi haiba cancer ji olhandana ba treatment je tawanga me haitare aduga mayam ngai du akoina screening tawse hai se akoina cancer do yeng kanda ma se cancer do diagnose tawkanda cancer treatment do tawga have natte akoina hai at least cancer do on the prevention hana tahusi haiba gi wakolon deni adu mayam da jo akoina awareness mayam ju pire adu eju mi gai kitang reluctant oiba hai tar
hostile oiba individual ju thengnarak pra sigi matang
kai doba
hostile oiba kitang sauning buga pawba
gi thengnai ye moida samna kanda akoina akoina field daga chatlaga akoina awareness akoi Karkinos dum continuously dum field da chatlaga dum akoi awareness piba adagi screening piba se screening to wai di akoina khuju khlai pudharaga makhada ada angang khaugi machin gi test to wa adagi breast se kamai to examine to ni ga moya takpa amasung akoina akoi gi doctor chatlaga moi gi examine to raga to bu matam sida mi khara tholak pa yaure tholaga su akoina the minus screening to se ha matam the hector saurak paga su yawe kai dobi to doina to roi gan haiba mi kharam di harau na hai di smine to re adu di to thoksi have the harau na adu di akoi to thoksage haiba su konga am yawe adu bu akoina thengnar bu matam da hostile oi su dum yaw da natte yawe hai tare aduga
adu minor hostile oiba or kind of minus screening to the kizaba mioi sing the kari paujil di thamining bage doctor
paujil hai taragadi sengna haragadi akoina nupi oibida main oina screening to bose cervical screening simdi niyom chuma to ko phai kai no hai je akoina screening to sai je aina pame akoi Karkinos na pame haraga to sai have natte all over world da chatna bi duni to sai harise kai no hai tai akoina khange cancer se up to some extent preventable ni haibase haibadi preventable ni habdi nganna khangau taragadi adu nganna khangau taragadi treatment je phajana to bi taragadi at least icham chamba procedure macham targa pre cancerous condition da thengna hu taragadi maje outcome yam phajayena adu na tabida phajana full blown cancer ga taraga laku matam da treatment to daragadi emotionally financially family gi oiba paisa ju changba amu to oiba adu mathak tong outcome ju akoi pre cancerous ka yengu matam da cancer ga yenga matam da pre cancerous na outcome jam phajabani na akoina mangjong na treatment to mangjong na akoina screening ta hotaragadi masi yam kanagani aina khanse
dei doctor akoina national level gi data yang pamatam aduga Manipur gi data yang pamatam da yamna khena baje leibra doctor gi personal experience hoje Karkinos imphal da thabak to matam da mayam thengnarak pada unique oiba Manipur gi scenario ju khara thambina ba haizari
lei haibagi athis usually akoina Manipur da yengu matam da as cancer per se da hai matam da akoi Manipur da na samna kan head and neck kumba cancer or otherwise esophagus kumba nupidan cervical cancer ke kaje more haita yamna ui haita akoi gi Manipur da se ayamna jo tobacco gumba chaba khotpa sidagi ayamna oigadra na khalle adu akoina sida Karkinos suppose cancer nare hairaga la aga jo akoina sida samna kan da mal screening to la diagnosis to matam jo first akoina usually patient amasung patient party da akoina experience hai targadi usually moi the patient party the break hek nuai to pau hai taren break to khotpa to je sudden break to na matam khar lawraga moi da hai tare patient da smine to raga nangi disease is smine to re cancer is smine to re hai poto magi condition laiong almasung stage e ka du niyom chumna takpi ba hai tare sidadi kitang di phabra na khalle ina ai wakhanda.
Thank you so much, Doctor. Matang ashwada attend ba commercial break lobjagi break matungda we have two more expert doctors adagi moidagi cancer laina sigi matang aduga treatment facility gi matang da khangina kishi.
Karkinos Manipur Cancer Care Institute amasung Research Center na taramna okchari. North East India gi oina apunba makok thongba cancer layeng sangsingi manungda Karkinos Manipur Cancer Care Institute and Research Center asisu amani. Aikhoigi anova makhalgi infrastructure asina cancer ga mari leinaba layengbada khudongchaba kaya piri. Afaba makhalgi diagnosis tagi horaga mathau taba layeng amasung mapung faraba rehabilitation fauba advanced radiation therapy amasung high-tech machines singi matengna aikhoina quality treatment amasung quality care piduna mayamgi seba tawzari. Aikhoigi experience leiraba amasung well-qualified oiraba Dr. Singa punna chatminaduna modern technology, precision medicine, chemotherapy amasung anauba pambaising sijanaduna afaba result piduna lagli. Manipur amasung thangnaba state singda leiriba mayamna cancer hairiba anaba asi layeng nabagidamak mapan lamda chatpagi mathau tadre. Mapan lamda fangliba adugumlaba quality treatment asi aikhoigi Karkinos Manipur Cancer Care Institute and Research Center asina mapan lamdagi tadana world-class facilities amasung quality treatment pibaga loinana yam affordable oiba amadi khudongchaba kaya amasu piduna lakli. Cancer layeng bada paisa ichang changdana layeng bagi khudongchaba pizari aduna cancer layeng ba matamda paisa changani haibagi nungsa thiningai oidre. Aikhoigi multidisciplinary team amasung tumor board na punna honaminaduna patient khudingmaki mathau taba layeng duna lakli. Aikhoina patient gi punsibu yam maru oina lobaga loinana cancer layeng bagi khongchat asida emotional amasung practical support matam pumbada piduna lakli. Aduna kanagumbana cancer treatment asigi matangda khangningba tananingba leiragadi pizariba contact number asida pau fawiro natraga Karkinos Cancer Hospital near Janims campus Porompat asida lakpiduna tanabiba yagani.
Break matungda amko hanataram nokchari. After the break, I would like to come to you, Dr. Pallavi Mehta. Doctor, when we talk about blood cancers, leukemia, lymphoma, and bone marrow transplants, these are treatments families in our state always had to travel outside, long distance to get the treatment. So could you please tell us plainly what a blood cancer transplant is and how this advanced care is finally available right here in Manipur?
So thank you for such an important question. It's a really important question, and with this question I would like to tell everyone to remove their fear of blood cancer. So most of the patients, they are thinking that having a blood cancer is like a death sentence. But nowadays, having a blood cancer is not like a death sentence. We do have a cure for many blood cancers. Patient can live a normal quality life, and patient can have a long-term disease control. So first of all, we should burst this myth that having a blood cancer means that patient will eventually going to die within a few months. So for blood cancers treatment, we usually do chemotherapy, and for most of the patient, chemotherapy is enough, but not all the patients chemotherapy will be enough. So in those cases, we decide, depending on the indication of the blood cancer, we decide which patient will need bone marrow transplant. So in a common term, we call it bone marrow transplant, but in a medical term, it is actually the stem cell transplant. We do not take the bone marrow cells from the donor, we just take the stem cells. And the process of stem cell donation is not like a surgical procedure. It is just like as simple like donating blood and platelets. So most of the donors, they are afraid of donating stem cells because they think that it is like a surgical procedure. They will have to undergo big surgical procedure under GA. So they are reluctant to donate your stem cells. So it's just a simple process. We can donate stem cells just like we are donating platelets. Okay? So in a bone marrow transplant, what we do exactly is we eradicate the diseased bone marrow of the patient. So I'll tell you the concept, what is exactly the bone marrow transplant. We eradicate the diseased bone marrow with the chemotherapy and the radiation. We make the space in the bone marrow of the patient so that the stem cells from the healthy donor can be transfused to the patient. And the transfusion of those stem cells is also just like a blood transfusion. It's not a surgical procedure. We are not taking the patient in the OT. We are not doing any big surgeries. It's just like a simple blood transfusion. We can infuse the stem cell, healthy stem cells into the patient. And those healthy stem cells will eventually make the normal blood cells, like a normal hemoglobin, normal platelets, normal WBC, and a normal immune cells. So these immune cells will prevent the relapse of the disease for the rest of their lives. So this is the basic concept of stem cell transplant. Now the question is, who could be the donor for these kind of patients? So the donor mostly is in the family members. So your brother, your sister, your parents, mother, father, even your grandparents, even your children, even a children as small as 1 year old can be your donor, stem cell donor. And it depends on the HLA typing. There's a test called HLA. We do the test. It is just a normal blood test. And after checking the HLA typing, we determine as a hematologist, we decide that which is the best donor for that patient, and we take that donor for the stem cell transplant. So this is the process of stem cell transplant, but it is not an easy process.
It's not an easy process, but doctor, you're saying all this facility, this testing process, this treatment facility is already available here at Karkinos in Impal.
Yes, so we have all the diagnostic tests which is required, the transplant. We have the expertise also. We have a doctor, like I have joined as a hematologist here. So in that sense, we have everything here, and so we need to now select the patients. So patient selection is also very important. We now need to screen the patient. We now need to make patient aware that this facility is available in Karkinos. So that patient should be aware whether his disease needs transplant or not. Most of the patients, they don't even know whether their disease, the neurological disorder which they are suffering from, they need transplant. So first of all, our vision at Karkinos is to develop a good hematology services and make people aware of the hematology and guide people whether their disease needs transplant or not. So that is our basic aim right now. And in near future, we are definitely going to start our transplant unit so that we can do both autologous and allogenic stem cell transplant, so that people don't have to travel to the faraway places. So till now, people are traveling to Delhi, CMC Vellore, and because this is not a one-step treatment. It needs a long follow-up, even up to 2 years sometimes. So staying Vellore or Delhi, Kolkata for 2 years is impossible. It is exhausting mentally, physically, financially, and emotionally. And sometimes patients do not follow up to these places and they come back to home. And the things get complicated. Then all the hard work which they have put in the transplant is just wasted, because the follow-up was not the proper thing. So that's why we need, Northeast state of India needs their own transplant unit, their own hematology center. So that is the basic vision we have at Karkinos right now, to start a transplant unit so that patients do not have to travel to faraway places and they get the standard evidence-based protocols which they are getting at the Vellore. The same treatment they will get here, but at the ease of being at home with the family, because after all, at last, home really matters. It really matters that patients should stay with the family members, and because it's a lifelong treatment. So yes, so that is our basic target and aim to start hematology.
Thank you, Doctor. Doctor, Natapi blood cancer, Masigi, Lai Patapsio, Manipur, Karkinos Hospital, the Magi Loimak treatment, Sigi expertise, Mayam Lady and Takpibani, Aduga Masi long term treatment, Oiba, Aduga stem cells, nothing but Magi treatment. Mayam Malay says the expertise Mayam Lay process my Taubaya, but the Mayam Lay, Duga Karigumba, patient Amana, Manipuri Wang, what is a pata, getting Masi long term Oiba, Dukumba treatment method, and home Zangna Mapanda, but the patient gidam to so awaba mayam mathengna kadoriba aduna sikumba mayam treatment facilities ya koi Manipur da leirabanina Manipur si matang da public na awareness leiba taragadi Manipur da dum treatment sathabada patient gidamukta su khudong cha da mayam leibadu handan bangam gani family gidamukta su khudong cha da mayam handan bangam gani hadi mapana sapadi yamna challenges miyam like doribnina aduna sigi awareness se leiba taragadi sida dum inak nagna yum manakta inak nagna smaina facility miyam je khudong chaba lawiba yagani habegi doctor gi admaina doctor na thambibani. Doctor, I would like to ask another question. When a local patient receives a complex diagnosis, how does Karkinos digital backbone ensure they receive the best possible treatment plan without having to fly to metropolitan city?
Sure. So this is also an important question, because now this is the digital age, and at Karkinos we always tell it's a technology-driven healthcare system. So firstly, we need to understand whenever a patient has been diagnosed with a cancer, so it is such a difficult time for the whole family. Not even the patient, it's a very difficult time even the family to go through the whole journey of the treatment. And every patient deserves to have evidence-based standard protocols without any compromise in the quality care. So we at Karkinos believe in this concept to provide health care which is evidence-based and protocolized, and every patient, irrespective of their background, they should receive that standard treatment. So that's why we have developed a digital platform, and we utilize this digital platform a lot in the form of a virtual tumor board meeting. So none of our protocols are just like a physician's personal opinions. So we usually have a virtual tumor board meetings regularly, where we connect our local doctors here in Manipur with the experts who are working in the leading centers of Delhi and even in the abroad as well. We connect with those experts who are working as a very experienced doctors in their field. We discuss each and every case in details, fine details, and we consider all the multiple factors, even related to their financial factor, their social factors, and then we customize the protocols depending on the patient scenario. We tailor-make their protocols so that patient gets the best standard protocol and without compromise on the quality. And patient doesn't need to go to Delhi, Vellore, and to big places to get the same treatment there, because we are also following the same treatment protocols. The quality is same. So we can assure patients that even in the comfort of their home, they are getting the best treatment possible. Because as I said earlier, home really matters in the case of cancer patients, and staying with the family and staying at home, it really matters.
Thank you, Doctor. Doctor, takui bazi hozik digital era zu area duna Karkinos ki magi digital backbones raise the haidi magi international level the leba national level leba experts mayam ji tanaraga patient magi treatment je lying pathap satha bada mayam je hojikti digital era zu ne mayam je connect toraga tato tashin toraga best treatment option patient ki damakta maina doctor singna decide tawe hena thambi bani. Thank you so much, Doctor. Makata pada Doctor Konjam Jina Devi lakchagi. Doctor, okay, cancer gi treatment je ma je yamna arrival treatment dina tamina sel yam changba. Aduga especially for family coming from lower income, even for everyone, it's a very expensive treatment. Aduna financial gi burden cities masi kamai na yeng biya bage aduga here at Karkinos for families facing financial constraint. Aduna mogi cancer patients singi damakta any special package swise khatambi.
While this man comes again, I am a cancer patient lap passing a question of Koi Manipur, Kibam Siangari, almost I am economically young people soap, I am like a the economically stable over Sulai, the cancer gi lying pathapasida, treatments is hung at Chataga the Riberico. Masida Kogi heck diagnosed or the Kiko. Quick diagnosis taking however treatment at Habagi may Amsterdam sales Muslim Chaniko. The Imunum Smine Hine Quina cancer treatment of the patient and nothing. Imunum Yanga treatment of Gidorigari, Habidi, Magi, psychological court, the social economical quiggy, Venamoxi drain Torocadorigari. A quiggy Karkinosta, Quig Ayusman Bharat, PMJ facilities available OJ, Adagi Quiggy, Chief Minister Gi Haxel getting Bang Hitarico, CMVST card. See patient ki package dum lo yause starting from koi diagnosis ki kano tongna test num to bu khotpa ko adigi treatment chatharapa whether it be surgery ki wagera adigi chemo ka po wagera radiation ki wagera ko see actually the bangi group ai ta ki PMJ ga kano ga sida chief minister gi haxel ki bangs the loina coverage pb hai ta adigi amana koi ki third party administrator insurance ki sisu on the process the delay je.
Okay. Samna Harbada, Karkinos Cancer Hospital is a panel for PMJY, Aduga CMHT, the insurance kizu, other way, my lady have. Dr. Makhata and the Kanzaning Basi was the Okina patients in the ICU Tambazi. ICU gisizu yam arrived in the Temasi Yamna. Importance about critical care the Maktado. ICU the Wutamdarga, the end of the life or a bra, patients in the Zudum family members in the Nunang Mapawa. Ado ICU da Tambagi, my critical care importance to highlight of you, ICU Zizu Yam the Tango or Vizala, so I highlight of you, doctor.
Siki question see Yamamaru of a question. I did cancer treatment, Chatar Pasida. On the whole, Tang with Natanako, ICU care of Pona, patient the car or a pagipum like. I am with the queen on co critical care, Hidariko, on Kogi ICU. Atopa ICU ba khinaba khara su leizeka on pogi ICU de de koina ayam matamda ꯑꯩꯈꯣꯏꯒꯤ ꯁꯔꯖꯔꯤ ꯇꯧꯔꯨꯔꯕ ꯄꯦꯁꯦꯟ ꯍꯥꯏꯇꯥꯔꯦ ꯄꯣꯁ ꯁꯔꯖꯔꯤꯗ ꯁꯔꯖꯔꯤꯁꯤꯁꯨ ꯑꯆꯧꯕ ꯉꯥꯛꯇ ꯑꯣꯏ ꯑꯌꯥꯝꯕ ꯃꯇꯝꯗ ꯀꯦꯟꯁꯔꯒꯤ ꯄꯦꯁꯦꯟ ꯍꯥꯏꯕꯁꯤꯗ ꯃꯁꯥ ꯍꯥꯟꯅꯗꯒꯤ ꯑꯇꯣꯞꯄ ꯑꯇꯣꯞꯄ ꯄꯦꯁꯦꯟꯁꯤꯡꯒꯗꯤ ꯈꯤꯇꯪ ꯑꯃꯨꯛ ꯏꯝꯃ꯭ꯌꯨꯅꯣ ꯀꯝꯄ꯭ꯔꯣꯃꯥꯏꯁ ꯑꯣꯏꯕ ꯍꯥꯏꯗꯤ ꯏꯝꯃ꯭ꯌꯨꯅꯤꯇꯤꯁꯤ ꯗꯥꯎꯟ ꯆꯠꯂꯒꯀꯣ ꯏꯟꯐꯦꯛꯁꯟ ꯌꯥꯝ ꯄ꯭ꯔꯣꯟ ꯑꯣꯏꯒꯟꯕ ꯑꯗꯨꯝꯕ ꯑꯣꯏꯒꯜꯂꯦ ꯑꯗꯒꯤ ꯑꯇꯣꯞꯄ ꯄꯦꯁꯦꯟ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯆꯠꯊꯔꯒ ꯀꯤꯃꯣ ꯅꯨꯡ ꯔꯦꯗꯤꯌꯦꯁꯟ ꯅꯨꯡ ꯆꯠꯊꯔꯒ ꯁꯗꯟ ꯃꯥꯒꯤ ꯑꯣꯔꯒꯟ ꯑꯃ ꯁꯣꯔ ꯍꯣꯟꯕ ꯋꯥꯔꯛꯄꯒꯨꯝꯕ ꯑꯗꯨꯝꯕ ꯄꯦꯁꯦꯟ ꯑꯦꯗꯃꯤꯠ ꯇꯧꯕ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯖꯩꯀꯣ ICUꯁꯤꯗ ꯑꯗꯒꯤ ꯑꯇꯣꯞꯄꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯦꯂꯦꯇꯤꯞꯇ ꯁꯣꯝꯅ ꯍꯪꯕꯤꯔꯤꯕ ꯖꯦꯁꯨꯅ ꯍꯪꯕꯤꯔꯤꯕ ꯄꯦꯂꯦꯇꯤꯞꯀꯤ ꯑꯦꯟ ꯑꯣꯐ ꯗ ꯂꯥꯏꯐ ꯀꯦꯌꯔꯗꯪ ꯊꯝꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯒꯤ ꯀ꯭ꯋꯦꯁꯟ ꯑꯃ ꯂꯥꯛꯑꯦꯀꯣ ꯑꯗꯨ ꯅꯠꯆꯗꯦ ꯑꯩꯈꯣꯏꯁꯤꯗ ꯄꯦꯂꯦꯇꯤꯞꯀꯤ ꯑꯣꯏꯅ ꯇꯣꯉꯥꯟꯅ ꯗꯦꯗꯤꯀꯦꯇꯦꯠ ꯒ꯭ꯔꯨꯞ ꯑꯃ ꯂꯩꯖꯩꯀꯣ ꯌꯨꯅꯤꯠ ꯑꯃ ꯂꯩꯖꯩ ꯑꯟꯗꯔ ꯗꯣꯛꯇꯔ ꯅꯟꯗꯟ ꯆꯧꯙꯔꯤꯅꯀꯣ ꯃꯥꯏ ꯃꯈꯥꯗ ꯂꯩꯖꯩ ꯄꯦꯂꯦꯇꯤꯞꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯥꯟꯅꯗꯤ ꯈꯟꯅꯩ only at the end of the life care ko patient sigi yaratra kanda when all the treatment modalities have failed ko palliative to chathabra haibadu madu lale palliative care si akhoi di ihan hana hek diagnosis hobadagi starting from the treatment digi dum incorporate toroga chathamine haitare ko ada palliative se da akhoi je haining is concurrent palliative care haitare hobadagi diagnosis hek khangbadagi pulapna loinaraga dum chatminaba masi sigi advantage na kaidoge haibada patient the quality of life se improve to behave adagi patient the financial burden adagi koi psychological social economic burden man su handai adagi ngasa in haije gi cancer amagi line patap chathabada patient the nate line bi se magi family su involved to godaba from the very beginning si sina moi the burden stress ya aduki matik handai haitare aduna akoi gi Karkinos tadi palliative की care सी अकोई dedicated unit ओइना लेजै को अदुगा हौरपदकी हौना incorporate तौजै मसी मयांगी मित ने हाय तारे को only at the end of life care हाइबसी मसी आराम बपोनी कोई हौरपदे हौना incorporate तौरगा patient सी मागी end of the life लाकुन का कांदा को यामना dignified way दा को याम dignified way दा मसागी own will दा patient खरा दुम कोई advance directive काने लेजै को हाइदि cancer नारा कांस्ता आइने सागी कोना हेंगवाई ꯃꯇꯝꯗꯨ ꯌꯧꯁꯜꯂꯛꯑꯦ ꯍꯥꯏꯕ ꯀꯥꯟꯗꯀꯣ ꯀꯔꯝ ꯍꯥꯏꯅ ꯀꯃꯥꯏꯅ ꯄ꯭ꯂꯥꯟ ꯇꯧꯔꯒ ꯐꯖꯅ ꯑꯩꯈꯣꯏꯒꯤ DNR ꯀꯟꯇꯤꯅ꯭ꯌꯨ ꯔꯤꯁꯤꯁꯇꯦꯠ ꯀꯥꯏꯅ ꯂꯩ ꯑꯗꯒꯤ ꯑꯩꯉꯣꯟꯗ ꯀꯣꯟꯅ ꯆꯨꯞ ꯍꯥꯞꯄꯤꯒꯅꯨ ICUꯗꯀꯣ ꯑꯗꯨꯒꯤ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩ ꯁꯤ ꯃꯌꯥꯝꯁꯦ ꯄꯦꯁꯦꯟ ꯃꯁꯥꯃꯛꯅ ꯋꯤꯂꯤꯡꯂꯤ ꯁꯥꯏꯟ ꯇꯧꯔꯝꯕ ꯌꯥꯏꯑꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯂꯤꯚꯤꯡ ꯋꯤꯜ ꯍꯥꯏꯅꯀꯣ ꯑꯣꯔ ꯑꯗꯨ ꯅꯠꯇ꯭ꯔꯒꯁꯨ ꯃꯥꯅ ꯑꯇꯣꯞꯄ ꯃꯥꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩ ꯍꯥꯏꯅꯤ ꯁꯔꯣꯒꯦꯠ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯥꯒꯤ ꯀꯩꯅꯣ ꯃꯥꯒꯤ ꯔꯤꯄ꯭ꯔꯖꯦꯟꯇꯦꯇꯤꯚ ꯑꯣꯏꯅꯀꯣ ꯑꯩꯅ ꯁꯨꯃꯥꯏꯅ ꯍꯥꯏꯗꯤ ꯗꯤꯁꯤꯖꯟ ꯂꯧꯕ ꯉꯝꯗ꯭ꯔꯕ ꯀꯥꯟꯗ ꯑꯩꯒꯤꯗꯃꯛꯇ ꯗꯤꯁꯤꯖꯟ ꯂꯧꯕꯤꯅꯕ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯑꯗꯨꯃꯥꯏꯅ ꯑꯗꯨ ꯐꯥꯎꯕ ꯑꯗꯨꯝ ꯍꯥꯏꯗꯤ ꯌꯥꯝ ꯋꯦꯜ ꯗꯤꯒꯅꯤꯐꯥꯏഡ് ꯑꯣꯏꯅ ꯐꯖꯅ ꯀꯦꯌꯔ ꯄꯤꯕꯤꯕꯗꯣꯀꯣ ꯃꯥꯒꯤ ꯑꯦꯟ ꯑꯣꯐ ꯗ ꯂꯥꯏꯐ ꯀꯦꯌꯔ ꯂꯥꯛꯄ ꯀꯥꯟꯗ ꯑꯗꯨꯒꯤ ꯐꯦꯁ ꯂꯣꯏꯅꯃꯛ ꯑꯩꯈꯣꯏ Karkinosꯇ ꯂꯩꯖꯩ ꯍꯥꯏꯇꯥꯔꯦ
palliative care gi matangdasu akhoi public na awareness kitang watpra hainasu dum khanjai aduga but hojik Dr. Nandan Chaudhary mai me makhada yamna di mai web sisu kan di kangkhalakpa male Manipur da doctor ni khangjaring baje doctor na hojik family bhawa moi counseling pi ba khotpa incorporate loin tawe habni na in what manner hojik ki cancer patient ki family singje sida Karkinos ki site gi moi da kamaina ready to hanba or kamaina moi bu patient this mai nare khole maunda si thenrak pe ha bagi challenges myam do moi da hana adapt to han bage si gi role ji kitang highlight tawbiyo doctor
patient the palliative care ki makhada lakpa gi ko palliative care gi da smaina patient se magi end of the life care kai pasagi all the treatment modalities myam se loina mak yadre haira kanda leiba kanda ko patient ki family sidi hobadagi to point knowledge fazana pibi raga ko adagi suppose aina hajing the organ no haira ne oral cancer bu ma haira patient se koi gi yam bleed togan ba koi gi treatment modalities koi gi radiation togre khotgre adu erga su think bu kai no ma adi ko na bleeding to go ya khotpa adi patient sina hogat pa khotpa ngamdre adi puthok pusin la ko su ngamdre haiba kanda koi gi team adum home visit no adum chatti ko aduga ingano last ki magi masa yam sojalakpa warak matam haitare ko adum kanda bleeding mo yam torakan sida koi gi e orak pa e haba adum to kan sida imung manu family caregiver singna e ubada da koi gi haksang da tuzungba painingai gumba oiba ko adum tholpa kan de koina sumaina bleeding mo tore khole haraga di patient se koi gi towel koi gi dark color towel haitare ko bleeding to we khole har kan aduna hajan bi mention bi ko habidi e do color machu awaw gum oiragadi e machu do ubada da koi gi panic to gada ko aduna dark color gum towels na so koi gi ido tholok pa kada namjan riba pressure pb ba khot pa do ergadi panic to bodo handhana ba ko habidi I say palliative care ki da when all the treatment modalities have failed ko adu ga kuina atopa option leitraba kada ko adumaina su patient na counseling proper guidance ko adu ga kuigi holistic way the approach to adumaina loina se heta.
Thank you so much, Doctor. Mathang da ha Dr. Thangjam Nirpendra dam lak jage. Doctor, when hoigi treatment je mai multiple steps involved or kadaba surgery kumba yaw kadaba precision radiation kumba yaw kadaba sikuma mayam je lak matam di kamaina approach to boge Doctor.
Sigi kana se wafam se akogi cancer na ko matam di cancer ki treatment se apne sanali camera ama leiba matam da ma stabilize tawna bage ko tripod am changi ko adoi tawna cancer ki treatment da su samna have tripod am changbu samana yero makhong amana akogi medical oncology ki chemotherapy aduma talang ta kapaga torpa ma atopa makhong amana na sai surgery ki part andigi atopa amana sai radiation mai yabi ki part aduna cancer se treatment to matam da ayam matam da hujiki hariba modalities ahum se am changi surgery khatang tawga loibana tabana traga radiation khatang tawga loibana taba the chemo khatang tawga loibana taba toin tawgana hariba modality ahum se noi changbana ayam ba oibanina aduna patient amma lakwa matam da moido properly treatment holding aida sigi modalities me am changa kani habs moido properly explain to hoba counseling to hoba ma change that we always do atokoi am patient could be a patient plus family members may say counseling people. And the patient china apoigi assign panjakiba same group of the high modalities may also knowing labnina. Patient na mapam amadagi surgery dagi and taking a psychic chemotherapy, medical oncology part, and the radiation oncology part is lam and which application darka later or same group the labnina. Aduna they are they find it much more comfortable. Adana mo siya na comfortable oy harima constant no impact laibinina ondigi doctor masin dasu sigi communication gap later ba and discussion nuai ba ko patient bi condition bi si laibinina si tawra si habi condition si nuai laibinina ko gi sigi process si makon sida no laibin nuai ba le.
Okay, thank you so much, Doctor. Duga Doctor dagi among khangzaning baze mayam je patient as well as doctors magi network or magi relations yam close nita dum labra masi kamaina maintain to buge phone call anytime patient na doctor the clarification pam matam anytime call gum tawraga dum mi khudong chaba labra or hospital gi site gi timely basis ta dum phone tawdana check tawraga patient gi health kum inquire to bu khotpa si swise khar thambi
leijai madagi kana duma aduga khoi doctor masin bi hare kati just never a communication gap communication gap am telite doctor amaga ki especially patient ki matang da paw se amana amaga ne paw ne phone andagi atopa amana akhoi gi always na sai na panjaki ba tumor board aina treatment si hawra matung da hawduna da tumor board ama akhoi multi disciplinary tumor board aina virtual tumor board aina tawra matung da treatment si decide tawra matung da treatment se hawraga karigumba maraktuda ana apli kenjin bani khangde ani akogi changes sama la ko asset reassessment taw matam da karimba treatment se ponga da darkar laire natraga kari decision ama lawsi ge ha matam da su mari koi punna mu phamina raga board tumor board ana mu phammaga mari da mu ko treatment decision se punna domina yaba andigi patient gi site ta koina patient china gim da laira kanda koi hospital gi site issue akogi regularly adum call mena tawi follow up ki akogi follow up to team mamu lairi mage person contact no na bolo raga lai adina sida regularly phone tawraga patient gi matam da suppose akogi magi chemotherapy ka pa gi matam bu yora e nataga amu investigation to koi matam yora recall akogi amu la aga ye follow up to no matam yora se patient regularly matam time to time koi no na amu phone tawraga no na koi contact tawra lai jai ya sigi pot sima and patient na karigumba hoida magi ani gim the problem ama laire at among the Nuitabum later, form of founding Karimum hanging Haramatan, the hospital, Lapan and Dragasu, Latin Ida Waragasu, a hospital, you contact number Amalay, so there's a contact Toraga, or you see through the Gitaraga, experts into the more context of Pounder Akanda, on patient and white of the Karino, have the Yarigi, a patient, Lapang Dragasu, the solved on the woman.
Thank you, Doctor. The Karkinos Cancer Care Cancer Hospital in Falls is a patient-friendly environment adugumba leiba aduma facility leiba adum hospital ni matanga shwaida attend ba commercial brem te lojage break matungda koi expert doctor singa rapid fire round chathajage.
Welcome to Karkinos Manipur Cancer Care Institute and Research Center, the premier destination for total cancer care in northeast India. Our state-of-the-art infrastructure offers a comprehensive range of cancer care services, from accurate diagnosis to personalized treatment and holistic rehabilitation. With advanced radiation therapy and high-tech machines, we deliver precise and effective treatments, ensuring the highest standards of care. Our team of highly experienced and qualified doctors utilizes modern technology, precision medicine, comprehensive chemotherapy, and innovative approaches to provide the best possible outcomes, making advanced cancer treatment accessible and affordable.
The Karkinos Health Center in Impal has started in full swing, and it is giving benefits to the poor patients and to the patients in the northeast region, especially in Manipur and the neighboring states, and we are giving it at a very affordable and a low cost price, and also accessible. So affordable and accessible care for the cancer patients is the motto of the Karkinos Institute here in the Northeast.
Our multidisciplinary teams, tumor boards collaborate to create personalized treatment plans, ensuring each patient receives the most effective care. We prioritize patient well-being, providing emotional and practical support throughout their cancer journey.
ꯑꯩꯍꯥꯛꯅ ꯊꯥꯏꯔꯣꯏꯗ ꯀꯦꯟꯁꯔ ꯂꯩꯕꯗꯒꯤ ꯑꯩ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯑꯁꯤꯗ ꯌꯦꯡꯖꯕ ꯂꯥꯛꯈꯤꯕꯅꯤ꯫ ꯑꯍꯥꯟꯕꯗ ꯑꯩꯅ ꯁꯤꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯕ ꯂꯥꯛꯄꯗ ꯌꯥꯝꯅ ꯀꯦꯄꯦꯕꯜ ꯑꯣꯏꯕ ꯗꯣꯛꯇꯔ RK ꯒꯧꯇꯝꯖꯤꯠꯀ ꯊꯦꯡꯅꯔꯦ꯫ ꯃꯍꯥꯛꯅ ꯑꯩꯕꯨ ꯂꯥꯌꯦꯡꯕꯤꯗꯅ ꯍꯧꯖꯤꯛꯇꯤ ꯑꯩꯒꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯂꯩꯔꯝꯕ ꯁꯦꯜꯗꯨꯁꯨ ꯂꯧꯊꯣꯛꯄꯤꯈ꯭ꯔꯦ, ꯑꯗꯨꯒ ꯍꯧꯖꯤꯛ ꯅꯣꯔꯃꯦꯜꯗꯕꯨꯗꯤ ꯂꯩꯖꯔꯦ꯫
Karkinos Healthcare. Care for your loved ones for a healthy and long life.
Break matungda amka hana taram nokchari. Doctors, now let's move on to quick fire round. So here I'm going to call out a common symptom and then or a scenario which we often worry about, and doctor can kindly explain what is it about in about 1 or 2 minutes max. So when is it an immediate warning sign to see a specialist, and when should we stay calm and not to panic? So first I would like to come to Dr. Thangjam Nirpendra. Your first question: a painful mouth ulcer or sore that pops up after eating something spicy. Akoina kariguma matsara matungda chinda ulcer thokpa pom thorokpa ado masigi scenarios.
Akoina pakhatkadaba condition khara lei natragana pakhaloidaba mako. Chinda ulcer ama leiba habsi kariguma akoina laihu gumba tawkiba lokuma thungba natragana akoina laihu tawkana immunity sondharpa matamda he akoi pokthok chin pokthokpa ina lei pokthokpa am yawi. Naraga kemcha vedaba thuptana leba adugumbaduti ayamba matamda it heals by itself hapta amani is days that noina wakil tawzai adu singidi akoina thoni am kana pakhaningai oide adubu karigumba lai gumba saista akogi haksang khanawgi kana manung sidaista chathatana leiraba ulcer ama leiraba it is painless ko hawpa matamda nadaba ulcer ama leiraba painless ulcer leiraba, but it does not heal ko heal to yadraba hapta ani hum sidaista adu itadi mari akoina section bam changi cancer.
Thank you, doctor. Painless ulcer. The second question, doctor: a hoarse or changing voice after a bout of bad weather or flu. Khanawgi voice kuma change or after flu kuma naru matungda masi chingna ningai oibra, doctor.
Kon sidaba habsi akoina lokuma thunga kandasu masi kana tawi kon sidaba yawi andagi laina ngakta natabida akoina mi amana kon voice ne yam sijinaba singer gumba isai am chitpa andagi teacher oza gumba ko andagi sports ka sanam tam yamna kan law khong ta uraga su matam kara consider but adugi singdudi voice rest taw kan da yam bana phaglakani adubu kari gumba haiba sing se yaw de vida kon se sidana sum la aba matam sana sidana la aba phaglaktraba adu itara gari madigi potsima akoina yangjambam sang kon si bisi akoigi vocal cord ta vocal akoigi kanogi magia cancer ama leramba natraga nodules ama leramba yai natraga even lung cancer itself moina su consider han bayai aduna yengjen bam changa
Thank you, doctor. Aduga ahum suba question na noticing a dark mole or spot on your skin that seems a bit dark. Koina sambru di ma sambru dagi he na muba ma thengna batar gadi masisu chingna ngai oibra.
Sambru si karigumba akwai da hana digi thaina digi sahi amani ka lag lisang sina lerba sambru oitaragadi karigumba ahongba leitraba madu yam kana kiningai oide tawbudabu karigumba nauna tholakpa sambru nataga hana leramba sambru oijaraga su karigumba madu chawkhal aba magi border akoi basi akoi gi diffuse orbane skin jiga puras kana demarcate taw lei nataba ko andagi ngasai gi sambru da machu hongakpa sambru dagi I tholakpa gumba hagazaraga adugumba leirakpa aduga sambru digi akoi bada masa masa sambru anobu chongthokpa leirak taragadi masi akoina section gadabni misi yengchinba masangi koi skin gi sambru gi oiba adugumba makhal gi melanoma haiba cancer makhal amalai adugumba do oibra haiba yengba misang.
Thank you so much, doctor. Mathang da hak Dr. Thingujam James Salakchage. Doctor, finding a lump or experiencing pain in the breast.
Usually akoina breast apomba malaiba amasung nabase. Samna haikanda usually period ka nupi oibigda di period ka sagona raga haita period matamdaga naba khotpa tawbasidi kaisu akaiba leite na pai aduga hana apomba su piaga leiba hana disang sanga leirakpa haitare paibda samna haikanda nadaba or akanbo oina firm oina oidrakanda di kaisu ka potawdi aduga suppose hauji pochina khangsaw chawkhlapagumba oiraba adagi samna haikanda akoina breast gi nipple discharge gumba lakpaga oitaraba adu oitaragadi doctor matang thokpa mathau tai na khal.
Okay. Thank you, doctor. Aduga anisuba wahangna feeling bloated or having gas after a heavy traditional meal. Saksa yam chasal malor kana pukse yam na bloated feeling to was masi.
Usually bloating to hai ja koine kainoma heavy meal gumba char wa dum bloating to wa jedum tong nei ko adu tawraga su sam nai kan da koine usually karam kan da kaino to ge hai ta dum kitang dang char ga dum bloated to dum leiba hai ta aduga the sang na hai de kuina hai ta pukse dum itana thalal lei he ga haibdo
Yam chadraga su
adumain to gonba se kaibukanda koigi ovarian cancer nupi gi da ovarian cancer gumba he koigan ba yawe ko adugi symptom hai tare ko bloating adum tawle se dagi samna kan GI gi cancer gumba da su adum thengna ba yawe aduna normal le koigi charoga heavy ga charoga adum nongalaga phab du ki sukai din na tan lisang sina hapta ama tham ka se adum tham ni ga se ka hai tare kitang tang charaga su adum ithanda thal lei type to do adu itari doctor am to dang thong.
Duga doctor gi ahum suba wahangna spotting or a little bit of irregular bleeding between normal menstrual cycle. Hogi thagi hum ka plak bazigi markta normal cycle ke manung da e spotting khara thengna batara di akoi section basi is it a warning sign?
Sidasu samna haigadi akoina spotting amurakum ga thengna ba hai tare yam hangai kem to daga amurtang ga thengna boi taradi samna haiganda hormonal changes pu oigera stress pu oigera hai tare aduna maram oira kitang ubasi dum yaunei ba adubu repeatedly or frequently hadam toina intermenstrual bleeding the spotting urakpa ko adagi samna postcoital bleeding umba urak taragadi kai lege haibaduma kupna thigatum thok tai kai ginoi tai usually endometrium uterine cancer gi endometrium gi cancer umba oigan busu he yawalle postcoital daga oiragan angang haumachin gi cancer ga he oibi yawe aduna maina yengthokko phai or otherwise akoina khamba loigra matungda haitare nupi na khamgra matungda chahima pura khamgre haire aduga maraktaga drop on tangu lak oi taragadi aduma yengthokko mathok tai kai leige habaduma kai ma adu poche samna postmenopausal bleeding ase magi symptom amani endometrial carcinoma gi oibagi symptom am oibanina aduma yengthokko mathok tagani kai leige underlying we should not ignore it aduma.
Thank you, doctor. Thank you so much. Next, I would like to come to Dr. Pallavi Mehta. Your first question is a small tender swelling under the jaw or in the neck during a throat infection.
Okay, so if someone is observing a swelling in the neck and if it is associated with sore throat, cold and cough, normal viral infection, and if it is getting subsided within 2-3 days when the fever has gone, or if you have taken some antibiotics and the swelling has gone, it means nothing to panic. So it is just related to the infection and do not panic, sit at home, you need not to see a doctor. But if the same swelling is painful, if it is increasing in size, it is becoming hard day by day and it is not subsiding over the weeks and there is no fever, you have taken antibiotics, still the swelling is there. So please you need to go to see a doctor and this and you might need a biopsy also for that lymph node.
Okay. And the next question is losing a couple of kilos after starting a new diet or a busy month of physical work.
Okay, so if you're losing weight and if it is intentional, you are doing a lot of exercise, you're going to gym, you're doing yoga exercises, and you're taking care of your diet, then nothing to worry. It is just an intentional weight loss, and whatever you're doing to lose your weight, it's working on you. So but on the other hand, if that weight loss is not intentional, you're not trying to lose your weight.
No exercise, nothing, but
Yeah, with
still
no
losing
exercise,
weight.
no dietary restrictions, still you're losing weight. And if it is a significant weight loss, like 5% weight loss in over the 6 months, your clothes are getting loosen up. So that's an indication that you should go and see a doctor. And especially if it is associated with fever, night sweats, lot of fatigability, then definitely you should go and see a doctor.
Thank you, Doctor. Doctor, takwiba je koi na hakchang ge koi weight se khakan hanna batar ga di aduga fever, night sweat ga associate tawba admai thingna batar ga di doctor da tana bi ho haba do thambi bani. Your next question is, Doctor, a sudden spike in fever that goes away after taking paracetamol.
Okay, so if you have a fever and you have taken a paracetamol and it's not coming back after taking paracetamol, most likely it is nothing to worry. It is maybe some common viral fever, and you need not to worry about that. But on the other hand, if the fever is persisting, despite you have taken a paracetamol, but fever is coming back after every day, every 1 and 2 days, and that fever is associated with other symptoms like extreme fatigability, weakness, some bleeding spots on the skin, rashes on the skin, or bleeding symptoms from any other sides, that means you need to check your complete blood counts. So it could be related to the hematological malignancy, and definitely do a CBC count and check with the hematologist.
Doctor, na takwiba je akoi na fever je dum hidak char ga zu dum hanjan jan dum fever yam toin tok salaba aduga akoi gi blood spot kumba thengna ba sikumba thengna ba tar ga di doctor tana bi ho haina thambi bani. Thank you so much, Doctor. Next I would like to come to Dr. Konzam Jina Devi. Your first question is suddenly feeling dizzy or faint after skipping a meal or standing up too quickly. Chakcha da wegi ko nga wo dira masi akoi chingan ngai oi bra do.
Hꯧꯖꯤꯛ ꯁꯝꯃꯔ ꯃꯇꯝꯁꯨ ꯂꯥꯛꯑꯦꯀꯣ ꯃꯇꯝꯁꯤꯒ ꯑꯗꯨꯝ ꯆꯥꯅꯩ ꯑꯩꯈꯣꯏ ꯏꯁꯤꯡꯒꯨꯝꯕ ꯌꯥꯝꯅ ꯊꯛꯇ꯭ꯔꯕ ꯗꯤꯍꯥꯏꯗ꯭ꯔꯦꯇꯦꯠ ꯑꯣꯏꯕ ꯀꯥꯟꯗꯁꯨ ꯁꯨꯝꯕ ꯀꯟꯗꯤꯁꯟꯁꯤ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯩꯀꯣ ꯑꯗꯒꯤ ꯑꯃꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯆꯥꯛ ꯆꯥꯗ꯭ꯔꯀꯥꯟꯗ ꯁꯗꯟ ꯗ꯭ꯔꯣꯞ ꯏꯟ ꯗ ꯕ꯭ꯂꯗ ꯒ꯭ꯂꯨꯀꯣꯁ ꯂꯦꯚꯦꯜ ꯀꯣ ꯍꯥꯏꯄꯣꯒ꯭ꯂꯥꯏꯁꯤꯃꯤꯛ ꯏꯄꯤꯁꯣꯗ ꯆꯠꯄ ꯁꯤꯁꯦ ꯁ꯭ꯄꯦꯁꯤꯌꯦꯜꯂꯤ ꯏꯟ ꯗꯥꯏꯕꯦꯇꯤꯛ ꯄꯦꯁꯦꯟꯒꯨꯝꯕꯗ ꯑꯗꯨꯝ ꯀꯣ ꯑꯣꯔ ꯉꯁꯥꯏꯒꯤ ꯀꯣꯛ ꯉꯥꯎꯕ ꯈꯪꯉꯥꯏ ꯍꯥꯏꯗꯕꯗꯣ ꯑꯩꯈꯣꯏꯒꯤ ꯕꯤ ꯄꯤ ꯈꯪꯅꯦꯝ ꯅꯦꯝꯊꯔꯛꯄꯒꯨꯝꯕ ꯑꯩꯈꯣꯏ ꯁꯤ ꯑꯣꯔꯊꯣꯁꯇꯦꯇꯤꯛ ꯍꯥꯏꯄꯣꯇꯦꯟꯁꯟ ꯍꯥꯏ ꯑꯗꯨꯝꯕꯁꯦ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯕ ꯌꯥꯏꯀꯣ ꯁꯤ ꯍꯧꯖꯤꯛ ꯁꯝꯃꯔ ꯂꯥꯛꯄ ꯃꯇꯝꯁꯤꯗꯀꯣ ꯑꯗꯣ ꯑꯩꯈꯣꯏꯅ ꯀꯔꯝ ꯍꯥꯏꯅ ꯄ꯭ꯔꯤꯚꯦꯟ ꯇꯧꯒꯗꯒꯦ ꯍꯥꯏꯕꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯆꯥꯕ ꯈꯣꯠꯄꯁꯤꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯁ꯭ꯃꯣꯜ ꯐ꯭ꯔꯤꯀ꯭ꯋꯦꯟ ꯏꯟꯇꯔꯚꯦꯜꯁꯇ ꯈꯤꯇꯪ ꯒꯦꯞ ꯔꯦꯒꯨꯂꯔ ꯅꯥꯏꯅ ꯆꯥꯕꯤꯕꯀꯣ ꯑꯗꯒꯤ ꯍꯧꯒꯠꯄ ꯈꯣꯠꯄ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏ ꯇꯨꯝꯃꯝꯕꯗꯒꯤ ꯑꯣꯏꯔꯦ ꯐꯨꯛ ꯂꯥꯎ ꯍꯧꯒꯠꯄꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯕꯤ ꯄꯤ ꯁꯗꯟ ꯗ꯭ꯔꯣꯞ ꯇꯧꯕꯀꯣ ꯑꯗꯨꯃꯥꯏꯅ ꯇꯧꯕ ꯁꯨꯝ ꯊꯦꯡꯒꯜꯂꯦ ꯑꯩꯈꯣꯏ ꯑꯍꯤꯡꯗꯒ ꯑꯩꯈꯣꯏ ꯃꯄꯥꯟ ꯊꯣꯛꯀꯦ ꯀꯥꯏꯅ ꯍꯧꯒꯠꯄꯗꯁꯨ ꯁꯗꯟ ꯃꯤꯁꯦ ꯀꯣꯂꯦꯞꯁ ꯇꯧꯕ ꯌꯥꯎꯋꯦꯕꯀꯣ ꯑꯗꯨꯝꯕꯁꯦ ꯀꯩꯗꯧꯒꯦ ꯍꯥꯏꯕꯗ ꯑꯩꯈꯣꯏ ꯀꯣꯛ ꯉꯥꯎꯕ ꯍꯥꯏꯔꯛꯄ ꯑꯗꯨꯃꯥꯏꯅ ꯇꯧꯔꯒꯗꯤ ꯐꯃꯨꯡꯒꯤ ꯃꯄꯥꯟꯗ ꯇꯞꯅ ꯍꯧꯒꯠꯂꯒ ꯐꯝꯕꯤꯕ ꯑꯗꯨꯒ ꯇꯞꯅ ꯍꯧꯒꯠꯄꯤꯕ ꯑꯩꯈꯣꯏ ꯈꯪꯍꯧꯋꯦ ꯍꯧꯒꯠꯇꯕꯀꯣ ꯁꯨꯝꯕꯁꯦ ꯇꯧꯕꯤꯕ ꯐꯩꯌꯦꯅ ꯈꯜꯂꯦꯀꯣ ꯑꯗꯒꯤ ꯁꯨꯒꯔ ꯋꯥꯡꯕ ꯃꯤꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯕ꯭ꯂꯗ ꯒ꯭ꯂꯨꯀꯣꯁ ꯗꯥꯎꯟ ꯆꯠꯄ ꯀꯥꯟꯗ ꯒ꯭ꯌꯥꯟ ꯈꯪꯋꯥꯡ ꯃꯥꯡꯕ ꯌꯥꯏꯀꯣ ꯑꯗꯨꯝꯕꯗꯣ ꯁꯨꯒꯔꯒꯨꯝꯕ ꯆꯦꯛ ꯇꯧꯕꯤꯕ ꯑꯗꯨꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯥꯒꯤ ꯔꯦꯒꯨꯂꯔ ꯏꯟꯇꯔꯚꯦꯜꯁꯇ ꯆꯥꯅꯕ ꯈꯔ ꯈꯔ ꯑꯗꯨꯝ ꯀꯣ ꯁ꯭ꯃꯣꯜ ꯐ꯭ꯔꯤꯀ꯭ꯋꯦꯟ ꯏꯟꯇꯔꯚꯦꯜꯁꯇ ꯄꯤꯕꯤꯕ ꯁꯨꯝꯕꯁꯦ ꯃꯊꯧ ꯇꯥꯏꯅ ꯈꯜꯂꯦ ꯕꯤ ꯄꯤ ꯋꯥꯡꯕ ꯃꯤꯗ ꯕꯤ ꯄꯤ ꯔꯦꯒꯨꯂꯔ ꯃꯦꯗꯤꯀꯦꯁꯟ ꯆꯥꯕ ꯆꯥꯗꯕ꯭ꯔꯥ ꯐꯖꯅ ꯆꯦꯛ ꯇꯧꯕꯤꯕ ꯑꯗꯨꯃꯥꯏꯅ ꯑꯗꯨꯝꯕꯁꯨ ꯃꯊꯧ ꯇꯥꯏꯅ ꯈꯟꯖꯩ
Doctor, see the rapid fire question in achadre, but just an addition haizaba tare. Karkinos Cancer Care Hospital is only cancer patient khatang yengbara natraga all other different kinds of ailments so dum yengbara si ju kitang kambir.
Akhoi se di kena tawraga di cancer patients the mainly dedicated cancer dedicated hospital ne cancer ngak tagi oina yenge ko.
Okay. Thank you, Doctor.
The non cancerous over the su lakpa yawe hoi margin ukoi keno oina whether cancerous over non cancerous over ko ꯃꯇꯥꯡꯗꯁꯨ ꯂꯥꯛꯄ ꯌꯥꯎꯋꯤ ꯌꯦꯡꯕꯁꯨ ꯑꯗꯨꯝ ꯌꯥꯎꯋꯤ ꯑꯗꯨꯕꯨ mainly dedicated to the cancer ꯍꯥꯏꯇꯥꯔꯦ.
Thank you, Doctor. Your next rapid fire question is: a person suddenly choked while eating or started coughing weakly and was unable to breathe. Hari cha matamda khudakta adum panba khutba tawse
hunba panba adumbasu ko sisu dum khoi scenario dum thengnaba dum yaujai ko sidai sida khoina yam thuna chaba ko yam thuna chaba wa ngangbuda chak chana chagano kaina khoina haine se asida sumba case dum thengnaba yawe ada makhan ani soi partial choking haibamga ko adagi full complete choking haibamga partial dana khoi ngasagi khoi soron begi airway ki passes hai tare si se kitang partially close oiba adum kanda di patient se amatam da mathanda lok ti khuba ngamni ba ko adagi ma adum koina haiba ko breathe sore hon ko paduloi ngamgani adum matam da koina karimta tawbada ka ta de just encourage the patient to cough out lok to kana kana khulna ba encourage to biba aduga condition am lay pura full choking to gi ba hai tare ko adugi universal koi gi choking sai na ma khut sina khut either one hand or both hands ko sisina smaina khut na manga kham sina smaina paija ba hai tare ko aduga patient si koi almost koi gi blue machu jang salak pa so hon bangam da ba wang nang bangam da ba lok khu bu sungam da ba adum ba condition thingna ba yawe ko adum badana koina tongan ba maneuver koi gi Heimlich maneuver hai ko koi gi patient si gi maning wai tang lepaga hai tare ko aduga patient sigi abdomen mapa khogi sida khoidou mapa leise ko khoidou sigi kitang hek mata ka khatlaga khogi Heimlich maneuver na khogi khutsina sumaina tasalaga hai tare khut amana ko aduga fist oina khoi khutum tasalaga khubi sina pukom da sumaina inkhat pa ko aduga another hand sina ina maning nom de ki lepak toini patient sina mamang nom de lei toini ko aduga ngasai gi khoidou gi mathak te gi hai tare ko kanna abdominal thrust se mangarak piba ko mangarak piba adagi maning lom de gi su khoi back blows na ko agi khubak sigi khunam hai tare sigi kidosna sisna koi shoulder gi blades da lei ko sigi marak da mangarak piba 5:5 to piba maning dagi mangarak dagi mamang dagi ngasai khutum ta salaga to bose mangarak piba ko si se koi Heimlich maneuver ko koi na choking to bokanda sigi immediate keno se adi patient bu magi no tong na ba recover tong na ba hai tare ko adu da sometimes patient mana palli ba poto pai thor pudum yawe adagi sidagi hena yam henjalak na hai tare patient se gyan mangi ba khot ki ba tawr ba ko agi sor holak traba adagi keno tawdraba mihun yaw to ko pata ga ko tum CPR dum perform to gani ko
Immediately doctor the rush to tare
rest of the
adagi doctor gi third question an elderly person develops sudden weakness becomes less responsive or starts breathing rapidly at home
sisna koi ahal laban da ko de kangle minor sum leiminar ma degi khangson sonjalakpa makhut masa khongkhut loinwa sonjalakpa adagi soron ga se khangwa waraga adagi gyan mangi ba unresponsive oigi ba ko adum ba kanda koina kai to ga ge have se koi elderly patient ni chahi yama banina magi hanagi hypertension sugar ko gi problem diabetes adagi atopa heart ki disease mayam ama leiram ba yai ko aduna koi gi to oi ba se stroke to ba yai heart failure heart attack to ba yai ko condition mayam ama leire adum ba condition da koina kai do ga ge have da patient se hana koina magi response se hani yengani ko phasana gyan lei ibra ko ibra have do gyan leite khote ko buda keno to de ha ka de koina dum emergency gi 911 di dum ko grani ko aduga patient se koi gi sordi hon ba ko 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 badadi phasana response to the sordi hon ba ko adu oira ga di mi hun nung loi leire ko le ha ga chi koina koi gi recovery position ana le patient se koi gi lateral da koi gi uppaga ko khong makha thang khong sina sanga thamaga opposite ki khong sina mathak nom ta cancel lak pa hai tare ko adu khuchna rest oraga koina maya magi mouth opening se yenga cancel ko gi angdoga sores gi lambi se phajana chatpa chatta bras me yengom da ka oi sometimes koina gyan mangwa patient da ko gi lei sina konchal laga ko gi airways obstruct to go yawe ko adu do open up to ba mai du khadang se thangat laga ko gi so ron gi passage se phajana chat ibra hai bu to me yengom da ka oi patient di dum mi hun di yawi bani response to phajana tawde hai ba wa ka tanish masai gi so holi bane aduga aduk matam da mana khara gyan la e khole haira gadi phare ko adagi khoi sugar wang patient ore sugar gi yengani bp wang ba khole bp do suddenly down chat lam be ai kari to buno ko puna ha du ma yengani ko at the same time khoi 911 di ko grabane ko adagi sidagi mu patients na mu keno to dana henzal lak na hai tare ko khoi gi sor hom da su holak tra le khra ba khoi gi mi hun su yarok tra ba yarok ka ta ko de khoi gi dum CPR se dum nambi gani ko aduga meanwhile da dum khoi gi healthcare khoi ambulance ki hai tare ko adu higher facility hospital pukhat pi batai adu fazana proper check up tor ma thau tare
irrespective of whether elderly person do cancer
elderly
patient
oidrasu sudden weakness sudden ko di mangonda sogram wa ba ko adu maina gyan mangi ba khot ki ba thukla gadi maina adu hospital facility pukhalaga fazana proper work up to gom la ka
Okay, thank you so much, doctor. Thank you so much. Aduna ngasigi from today's discussion, there is one thing that we all need to remember. Madudi karino harga early detection save lives. Aduna cancer laina or any laina ze khoi nang ta detect ta hoba tar gadi magi lang patap chathaba dagi punsi kan bada yam chawna mateng pangi habjing asigi discussion sina yam na mayek sing takle aduna chinda ulcer am thokpo gera natraga khoi fever je hanjan na fatraba aduga fatigue leiraba aduga adum blood clotting kumba leiraba doctor mayam ama khoi rapid fire rounds raise da mayam ama thamgi ba karam kana chingna ningai oi karam kana doctor approach tawgani haibase yam mayek singna thambire aduna early detection is everything haizabatare, and for the first time mayam je akhoi gi singma chingna bal like ba matamda akhoi gi Manipur maktada leiba cancer gi hospital or ba Karkinos cancer hospital Porampat leiba hospital gi facilities mayamna khudong chabs logi ba yagani khoina any patient kano appointment loading batar gadi phone number ani thamjage ahan bada 87875 23654 among han haizer bada 87875 23654 natraga 700 575 3510 amuka han haizer bada 700 575 3510 number ani asida izra call tawiduna appointment lawi ba yagani ngasi akhoi discussion sida mapung fana sarugya bikhiba akhoi doctors ahamada Dr. Thangjam Nirpendra, thank you so much. Dr. Pallavi Mehta, thank you so much. Dr. Tingujam James, thank you so much. And last but not least, Dr. Konjam Gina Devi, thank you so much for all the insightful discussion and enlightenment that you have brought to our viewers. Thank you so much once again. Nasigidi Karkinos Cancer Care Hospital gi Dr. Singa Smaina wari watai sanaduna cancer gi matang duga lying pathap ki matang duga facility gi matang da khanajabasi matang shoi lusinjaragi. Thank you.
From its inception, Karkinos was conceived to try to tackle a really big problem at the scale of all of India, trying to find cancers in populations that historically have not been screened for cancer using conventional methods, but really jumping over those historical approaches and applying new technologies, digital tools to allow patients to be risk assessed and undergo screening with available methods, as well as blood-based early detection methods, currently still under research, navigating those patients to care environments, and applying the very best molecular diagnostic technologies so that patients can pursue the very best treatment for them. It's this vision and the assembly of teams and technologies to really cover that entire broad domain that I find not only inspiring, but really unprecedented anywhere else in the globe. I think many of my colleagues who've enlisted in this effort as advisors, we do it because we see the potential impact in India and how the Karkinos model can be scaled and actually deployed in other geographies as well.